only employee when we were funded. So I know the story. So I'm here to tell a little bit of the story.
Awesome. So just to kind of start off and kind of see who is in our room here today, we invite you all in the chat to drop name, pronouns, your organization, and the county you're from, as you enjoy our photo of our new center that we moved into about a year ago. With some funding, we were able to grow as we get more money.
And while people are doing that, we are sharing space right now because we are there's construction happening at our center. And so we've got people doubled and tripled up. The building that you see on your screen right now is under construction, and they are tearing down walls to create a space that more than 20 people can be in at a time. So hopefully once that's finished, we can have our groups inside and up to 40 folks. So I see that Kathy is here from Trans Family Support Services. Thanks for coming. Hi, Juan. Thanks for coming.
Welcome, Adam. Hi, Ty.
Hi, Ty. Okay, while people are doing that, we can continue on.
So just to kind of have an overview of things we'll be talking about today, we're going to be talking about MHSA funding components, our process of how we got funded, which we understand might not be your process, but we want to kind of just show an example and maybe find some ways to get access to your funding in your counties as well. We really want to talk about those relationship building components and also some gatekeeping that can occur and that we've experienced personally. Best practices to follow to kind of help you get funded and to stay funded. And also about the sustainability about, once you have that money, how to keep it coming. And then hopefully if we have some time, maybe an activity or just kind of really thinking about your own county and ways that you can engage the work that you do as well.
Okay, so this is an overview of the MHSA funding components. And as you see, there's lots of different programs that MHSA funds. In November of 2004, California passed Proposition 63, which established Mental Health Services Act in an effort to reduce the long-term adverse effect on individuals, families, and states and local budgets resulting from untreated serious mental illness. So MHSA funds programs that should expand and enhance public behavioral health system through care, through cultural competency, through community-based collaborations, focusing on inclusion of clients and family members in the behavioral health planning process. So MHSA funds these projects through a 1% tax on adjusted annual income for people who make over $1 million. So if you've heard Mandy talk about where the funding comes from, this is the millionaire tax. So, and counties get that money doled out to them to fund their own community service and support projects, which you will see here is called CSS, Prevention and Early Intervention Projects, which is PEI, Innovation Projects, which is, we just call it innovation. Then there's capital facilities and technological needs, and workforce education and training. And the reason why those two on the bottom are separated is because those are typically held within the county, and they don't contract out for any of those partnerships. So prevention and early intervention programs are designed to prevent mental illness from becoming severe and disabling, with an emphasis on improving timely access to services of underserved populations. So if you're LGBTQ, you're underserved in the mental health system, so we automatically qualify as a good partner. Community services and supports. This is the largest pot of funding, and this goes to provide direct services to adults, older adults with serious mental illness, or children and youth with serious emotional disturbances who meet a criteria that was set forth by the Welfare and Institution Code. So in our town or in our community, in several communities within our county and other counties, the CSS projects will look a lot like wellness centers. So we have a lot of wellness centers that pop up. They are day centers. They serve adults who've experienced they have an experience with mental illness, or are former consumers or current consumers, even family members. And they're very much like a resource center. They look exactly like sort of our community center, but they're not LGBT focused. They're mental health focused. So there's lots of classes and things for people to do. However, this pot of money in our community has been sort of gobbled up by one really reliable partner. And they do amazing work. But anytime there is a wellness center or a CSS project happening, it's usually this one partner that's doing it because they have a model that works. Innovation money is a component that's designed to test time-limited, new, changing mental health practices that have not been demonstrated as effective. So there's sort of new ideas that communities can use to see if it would work. And so we currently have an innovation project with Tulare County. We also have several PEI projects in different counties, and we'll talk about that a little bit later. But those innovation projects are to infuse new, effective mental health approaches into the mental health system, both for the originating county and throughout California. These projects may focus on increasing access of underserved groups like the LGBT community, increasing the quality of services that people get, including measurable outcomes, promoting interagency and community collaboration, and increasing access to mental health services. So that's the overview of the types of different funding that are available.
And I'll just add, I feel like with innovation projects, especially for our LGBTQ community, I feel like anything you do is going to be innovative because the county as a whole probably isn't doing any of that work. And so as LGBT community organizations, like we really are bringing in those new ideas for them to maybe implement at a larger scale. Instead of like us being the only entity, like we want to have that support from other organizations and not just be the only one. We don't want to gatekeep people out. We want to be able to share these ideas out to help support our community so that there's more access for them as well.
Okay. I know I said I was just here to provide background.
It's the story time.
So our process of getting funded was in 2017, we had a suicide prevention task force, and they were funded through prevention and early intervention within our county. A lot of counties have this PEI program. And at the time, they had partnered with the Trevor Project. And so they were paying the Trevor Project, I think, $12,000 a year to license their name. And they would provide like one training to one staff member, and then that person would go out and do trainings to our community. So that person who was doing those trainings was retiring and was sort of stepping away from that role. And we had just started the center in 2016. So that person, his name is Van, he recommended that the Suicide Prevention Task Force speak with us. So they did. And instead of partnering with the Trevor Project and licensing their name to be used on their materials, they decided that that $12,000 or that $10,000 would be much better suited for a community-led organization. And so that started our first funded MHSA program, which was prevention and early intervention. So from that agreement, we started doing suicide prevention trainings, LGBT 101 trainings. We offered access to free mental health, and we started a pop-up in another community. So this was an interesting project because at the time, our suicide prevention task force was funded through 2 counties. It was a partnership between Kings and Tulare County, and that ended after our first year. And so you'll see how that splits. So in 2018, when the suicide prevention task force split, Kings County wanted to keep doing the pop-up. So in order to do that, they had to fund us out of their own budget. And so what happened was that we had a project now for Tulare County, and now we have a project for Kings County. And the pop-ups were really great. You know, we did education nights. We did one every month. That was the model that we used. And it was also, again, from suicide prevention money. So it was very easy for us to make the case around suicide prevention because there's a lot of data around it, especially for youth. So these counties were looking for partnerships that would do the most good for the most underserved. And I think we were just at the right place at the right time. So, but what happened is that we, over the couple of years that we worked with suicide prevention, using these pop-up models, doing education, doing free mental health, we developed a program that other people wanted to replicate, other counties wanted to replicate. So that leads us to the Fresno Department of Public Health, which is another in Fresno County, the 3rd county that sort of approached us with the PEI project. So Spencer's going to talk about that.
Yeah, and so with the Kings County, though, with those pop-ups, like Brian was saying, we started kind of small and kind of did like a single group a month, but then the need started to grow. And so now we currently went from doing 1 to 2 pop-ups a month to having 4 a month, because we showed the need was there to not only keep that program there and have those pop-up groups, but also that we needed it more frequently. So these pop-up groups, just to kind of give an understanding of what they were, we had general LGBT groups that we did twice a month. We had our trans support group because we recognized we had our own groups here in Tulare County, but Kings County had a difficult time accessing those spaces because of travel. Tulare and Kings County are very rural areas. And so we take up a lot of square mileage, which can be very difficult when you have to drive 30, 45 minutes just to get a group to have support for an hour and a half. And so we were able to grow that program out in Kings County to have the general pop-up groups, trans support groups, and now recently we have youth-specific nights so that our youth in Kings County feel like they're being seen and heard as well. And then, of course, outreach and education, which is a big part of what I do, is training our community, because we look at training our community as suicide prevention. Because if we educate our teachers, administrators, businesses, organizations, we can all feel a little bit safer in our community, because sometimes we feel unsafe. And so the more that we can educate people around what they don't understand, and it really does shine a light on our community and really that education that they needed. Of course, living in rural areas, then of course, we're asked to go to other counties. So we ended up in Fresno County, and we partnered with another organization in Fresno to try and do some more pop-up groups. The hard part about this one was it was through COVID. And because of COVID, it was Zoom. And so we were trying to access this county that we are not in. And it was very difficult because those were not our community members. So we really relied on the other organization to help us. And we did the best we could. I mean, we had Zoom meetings twice a month. 1 month I facilitated, and then another month they would facilitate. So we were kind of sharing the workload and the support, and really learning from one another about what our community needs are around all these counties. And so we did virtual. We tried doing some in-person when it was safe for us, which of course, when we had an in-person one, we had way more people attend because they're like human interaction. And so what we kind of learned from this was like, it was great. It was a great opportunity to learn, but also understand our own capacity. So that is something that's really important as you go through this work, that yes, you want the money, but you got to make sure you have the capacity to do the work and not to overwork yourself and burn out yourself because you're just trying to take all that money in because you want it and need it. And so something we kind of learned from this is, knowing our limits. So unfortunately, we did not renew with that contract because we knew we didn't have the capacity to do so. And we happily said, hey, if you want them to do it, that would be great for them to do, because we just don't have the ability to do so right now. But it was a really great learning experience for me to know when is my limit.
And there's a question in the chat. So it's so NorCal Outreach Project asked, these projects are PEI ? And I said yes. So these are all prevention, early intervention projects. And as you can see on the slide, our budgets started at 25,000. Well, our budget started in the 10,000, and then it got moved to 12. For a couple years, we were at 25 with our suicide prevention task force, and they just raised it to 45. Part of that budget right now, about 50% of that budget goes to contracted mental health workers. So we pay mental health workers who are LGBT competent to see our clients for free. So we pay for their hours out of that $45,000 a year. And then you can look at the Kings County pop-up. We had a contract with them for 3 years at $10,000. It barely covered gas, supplies, hours to get there. We had people volunteering. So the budgets were really small. They finally increased the budget to 20. I mentioned this because prevention and early intervention funds, once they're sort of doled out to the county, there's not as much oversight. So that department can determine based on their committee. Ours was Suicide Prevention Task Force has a budget of $300,000. They can decide how they want to spend that. And so they didn't have to go to the Board of Supervisors. We didn't have to submit a proposal. It was basically a very basic scope of work, which said we're going to do these. We're going to do 12 events. It's going to cover these things. It was a very easy contract to get passed or drafted.
Awesome.
Oh, it's still me. Okay.
It's yeah.
So we're going to talk about relationship building and gatekeeping. So I know that we had mentioned, I had said being in the right place at the right time, and it really felt like that. So in 2018, we were approached by MHSA, an administrative specialist at the time, in a cultural competency meeting. So by this time, it's 2018, we are doing work for the county at $10,000 a year. And they've asked us to join their cultural competency as sort of like the only LGBT voice in the room, which was pretty interesting. So that was me at the time. It's still me. I still go to those meetings, but we were in the right room at the right time, again, because I met a person, her name was Katrina, and she said, hey, I need to talk to you after this meeting. And I said, okay. And she said, have you ever heard of innovation funding? And I said, no, I hadn't met Mandy yet, but, and she said, our county has, if we don't apply for this funding, our county will lose like $1.25 million. It's going to get reverted back to the state. So we're looking for projects, and we would like to invite the Source to apply. So at the time, she said, the sky's the limit, give me a budget for $1.2 million. We'll fund whatever you want to do. We love the Source. We love working with you. And I know this is like not everybody's story, right? Their counties don't do this or say this to them. But we were really excited. And so we created a budget and we applied. We were in a cultural competency meeting. If I had not gone to that one meeting and met Katrina, we would have never known about this innovation funding. And so we went through a process called the innovation stakeholder process. They heard many different pitches from other organizations about how they could come up with innovative projects for the county. They ended up choosing ours and another project, and that went to the state, and it took quite a long time for that to go through. I think we wrote the grant in 2018. It was approved by the Board of Supervisors, I think before the end of the year. And then we were in front of the Mental Health Services Oversight and Accountability Commission, I think in March. And then our grant was awarded. So I mentioned Michelle Cruz here on the slide because she has been there the whole time. She was part of helping us draft the proposal to go to for the innovation project. Yesenia Lemus now oversees our project. So these people are allies within our county. And so we would encourage you to, if you are supposed to, because it's you should have an MHSA Cultural Competency Committee because your county receives MHSA dollars. So if you're not attending those meetings, find out where they are and go to them, because they have money to spend on innovative projects. And in our community, even though we live in California, there had never been an LGBT funded project at the county or led by LGBT people. There's other spaces that you can be in: the mental health board meeting, the cultural competency committee meeting. There's all kinds of different branches, adult systems of care and wellness and recovery. Different from county. Is that different from the county CCC meeting committee? So there's a question from NorCal Outreach. Is that different from the county CC committee? And I'm not sure, is what different? Is the mental health board meeting different? Is that the question?
Sorry, no, you had said the MHSA Cultural Competency Committee, and so I'm wondering, is that different from the Cultural Competency Committee that the county uses in general for all of mental health services?
No, it's for us, that's what they call it here. They like to use the MHSA name because they're MHSA funded programs, but in your community, it might just be called Cultural Competency Committee. I think it's the same. And then just being in those meetings and showing up and giving input and answering questions, and sometimes being the only LGBT person, queer person, trans person in the room can be uncomfortable, but it has allowed us to be sort of in these right places at the right time. So some other places that you should find out when they're meeting, and you'll find out in these other meetings like cultural competency or the mental health board meeting, are these 3-year mental health community planning processes. And I know Kings County is starting theirs right now. And they do a lot of focus groups. They talk to community members, they talk to consumers, they talk to marginalized communities. And so we participate in those focus groups all the time. We say yes to them when they ask. We weren't always invited. So that's something that can be gatekeeping, is that if they don't know you exist, if your program exists, or that you weren't invited to these focus groups, then your voices aren't being heard. And so I would say that the best place to advocate for your voices to be heard, again, is at that Cultural Competency Committee meeting, because they will be talking about the 3-year community planning process. There's also a planning process for innovation funding, and that seemed to be even more strict. So this was just invitation only. And I'm talking like the police department, like the Source. I think the Suicide Prevention Task Force was there. 2 other contractors were there. It was a very small group of people. And again, it's those partnerships that they know and trust can deliver a grant within a very short period of time that they can trust is going to be, is going to go through, get approved, or they have a trusted relationship with those folks. So even though it's not, I don't think it's purposefully gatekeeping, it feels a little bit like that. We just happen to be on the other side of the gates this time. And so what we would do in the next process, I think, as a community organization that has a relationship with folks, is let people know who need to be there. So like new community organizations, people that need funding, we would let them know when these things are happening so that they're in those spaces as well. I think it's our responsibility to kind of pay it forward and let folks know what's going on so they're not sort of kept out of these rooms purposefully or unpurposefully.
I mean, a lot about like relationship building overall is about that familiar face. And so, you know, being consistent with going to those meetings or trying to get access into those meetings, that when they see that face over and over again, that you might not be talking to them at that time, but then there might reach a point where that conversation comes where it is LGBT focused. And they know, oh, hey, I remember seeing Brian or Spencer in these meetings. I can reach out to them and I can talk to them about these things. So like for Out for Mental Health right now, one of the, you know, the goals that I'm trying to do is always be at those mental health board meetings. I got the invitation to go, so I'm going to make sure I'm always there. I'm not an active like board member, but I'm there listening to those conversations so that if a time arises where I need to step up and to speak, I'm not just a stranger who showed up one time. So it is about that consistency and making that familiar face and networking with people, which can be difficult because I know for me, I really started my work kind of in the height of COVID. So I got to know the email addresses and now I'm starting to get to know the faces, know the names a little bit more. And so that really helps me when I need to reach out and to build a relationship with someone that like, hey, like you may have seen me here, you may have seen me there. And that really helps kind of just ease into those conversations of like when you need to ask or make a request for support or for funding. They already kind of know who you are instead of just a random, you know, to them, a random organization. So we kind of talked about the innovation funding, you know, being an invitation kind of, which is a gatekeeping kind of tactic, being a part of those community stakeholder processes and just, you know, even if it's just to show up and to be there, right, until it's that time to really speak up and say things. We've had our innovation project that I've been working on is connectedness to community. We did a lot of research from from not only our LGBT folks, but also from county providers to identify what's going on in our county, how can we support our county in supporting LGBT clients, and then also what our clients need, what are their mental health needs, what kind of support are they looking for, and how can we better access that for them? Because for a lot of them, what we heard was, you know, not having the best mental health experiences, whether that's front of desk, right, in your office space or with one-on-one or, you know, those providers. So how do we educate those providers so that they feel comfortable working with those clients, can feel competent when working with those clients, and so that they can provide that mental health support and not focus on maybe issues that don't need to be focused on in that space. So we just continue doing that. And then what to kind of watch out for though when you're doing this work and what you are going to try to get funded is, you know, really read those county grants and budgets so you know kind of what you're getting into, and that also, you know, you are going to have to fight for your communities. You are going to have to be that voice, but I think it's important that you also take care of yourself. I always say, you know, you can't you hear that can't pour from an empty cup, but also, you know, you can't set yourself on fire to keep people warm. Because you're going to burn yourself out. And so really just being aware of the relationships you're building and, you know, being able to support one another in the work that you do. Like we've recognized in our organization that, yes, Brian really helped start this organization, but he's got to pass that on to other people and help us build those relationships that are sustainable. So that one day, if Brian is not running our center, we still have someone in place that can continue the work that he started for us. And so that those relationships stay strong regardless of the people there, because we all know with county, they turn, right? They're just going and kind of rotating through new people. And so how do we keep those new people in connection with us in the work that we do as well?
Do we have questions or is that in a new slide?
Yeah, it's from somewhere else. So kind of things like we've talked about, but really want to reinforce as well are these best practices and things about sustainability. So really showing up to those meetings and being seen. I know for me, I hate sometimes being on camera for Zoom, but really creating that face and showing those people who you are. And, you know, if your county is small like ours, you're going to end up running into these people in real life. You know, I pretty much do all of our trainings for our communities. And that has been a really great relationship building piece for us. Because I'll go to like a grand opening for something and everyone recognizes me as Spencer from the Source. And it's a little scary at times for me to be recognized, but I understand the importance of being recognized because then it's that familiar face. And so just continue showing up, being in those spaces, you know, emailing those people and creating those connections in the meeting and outside of the meeting as well. If you have not learned how to write grants or scopes of work, it's a really great tool to learn. I'm still learning. It can be a big ask to learn how to do, but if you're needing that money, knowing how to write those grants and using the words that really capture what you're doing can really bring in that funding for you as well. And once again, write those scopes of work, understanding your limits of what you can do with that money and not oversell yourself to the point that you feel like you have to do it all and you don't have the capacity to do so as well. Don't be afraid to ask for the money. Don't be afraid to ask for the big money, right? Know your worth, essentially, because if you're looking at kind of how we are, not a lot of people are doing that LGBT work. And so you are a vital asset to your county, and you should know that you're worth every single penny, every dollar that they can give you. And don't sell yourself short. But you can give them solutions, right? If they have an issue, come with that solution that, hey, we can work around this, we can solve this. And we have ways that we've worked around this to solve these issues in other places. As we put in there, it's the secret sauce, right? Knowing how to respond to these things. A lot of people don't know how to respond to LGBTQ issues because they're not LGBT. And so they panic, right? And so they might look to you as that expert, and you can use your personal stories, your journeys to help support them in understanding how to help the community as well. Getting your 501c3 in place, getting yourself organized and keeping it organized, right? Working together as a team. If you're a small organization, right, you might only have 3-4 members on your team. But you can grow, right? There's that potential to grow. If you get more funding, you can do more for your community and grow into an organization like ours that has 12 staff now, 12 fully staffed coworkers. And that's great because then we can balance out that work and support one another and come with more ideas of things that we can do for our community and support them in those efforts as well. Get compliant with the insurance like liability, auto, workers' comp. This is again kind of setting up your organization to be able to take care of your employees so that you can have a good relationship in-house as well. I think this has probably been like my best job I've had because I feel valued. I feel like I am seen, I am heard, and that's not always the case in some organizations or businesses. They look at it like, hey, you're just a worker, you're just here providing a service, or you're just doing something and that's it. Really creating that space within your own organization can be really, really important so that your employees know their value and their worth as well, so that they can continue doing the work that you ask them to do. Being a good partner is another good one. We collaborate a lot with other organizations here. Like we said, we're not the only one who wants to do LGBT work. We want to be able to go to another nonprofit who might have a sub group that's an LGBT, and really partnering with them and supporting them in their efforts so that they can come to us and also ask for support too. So it is kind of a give and take as well when you collaborate, and really just, when you plan, maybe it's an event or a workshop or just something small to do with another organization, that you deliver on what you say. And that really can just be really small requests or asks, and that it builds that relationship with one another, so that when you're ready to maybe take on bigger tasks, you have that support because you've shown them, hey, we've shown up for you. We'd like you to show up for us as well. And just really creating that healthy relationship between that give and take, the reciprocity, basically. You want to advocate internally for your organization and the things that you're doing and supporting, again, your employees and things, because they are valuable to you. And you couldn't probably do that work without those employees as well. I know I couldn't do my work without the support from other folks in this office. And that's, we reciprocate that back and forth and how we can support one another, because all the work we do impacts every single one of us, whether they're youth, adults, whether they're lesbian, gay, bisexual, trans, queer, whatever their identification is. We want to support them all and want to create a community that doesn't isolate from themselves internally either. We want to be able to have our lesbian and bisexual folks feel comfortable in spaces that are trans spaces. We want our trans folks and gender nonconforming folks to feel comfortable in those spaces that maybe aren't trans spaces. And so really building that connection even internally with our community so that no one feels othered or isolated, because we get that enough from our society at large. Building those closer relationships, right, with other organizations, with other people, finding those key people is really important, even if it is that revolving door in our county. There's always someone. It's just trying to find that person. I feel like there's always an ally somewhere, whether they're that silent ally who's maybe working internally in their own organization. Try to find those people to connect, let them know that you're there to support. You never know who might reach out to you and be that one person that could really change everything for what you're doing. And lastly, engaging in LGBTQ plus stakeholders in a task force. So like our Out for Mental Health task force, we're engaging those folks, whether they're a part of the community or allies to the community, because everyone brings some type of understanding or approach that we might not be aware of. Something that I've learned from training our community is, and something I tell them all the time is, please ask questions, because I don't know what you don't know. And if you ask those questions, that helps me frame an understanding of your experience, because your experience is different than mine. And that really helps build those relationships to where after a training's over, I might get an email from someone asking me, more questions and how to do support and what they can do to help support our efforts, and building more relationships in our schools and our county and just other organizations, so that we kind of build this stronger community as a whole as well.
And the county seems to really like that approach. I wanted to mention something else. They love task forces. It's like the magic word. And they love community input. And so anytime it can be, they also like working with familiar faces, but anytime it can be Spencer and somebody else, or Spencer and a group of folks, it really gives, it shows them the power of community. And I think the county is really like, it seems like they're hungry for it, like in terms of like the way that community organizers are very nimble. Our county loves to contract with community partners because we can do the work faster and cheaper than anybody else, than they can do it. So in a lot of ways, we are already the solution to their issue or the issue or whatever they've come up with in their 3-year community planning process. So a lot of times, if LGBT folks have been identified for a program, there's nobody on staff that can devote the time or is an expert or doesn't know what to do. And if you're in that room, like Spencer said, at the right time, then you can say, hey, we'll do that. We've been doing that for years. When we've been doing it for free. So if you can give us 10 grand for it, we'll be happy to do it.
Yeah, no need to reinvent the wheel or have someone try to create something new if you already have something in place that they could benefit from. It's just, once again, it goes back to that, know your worth, know how much to, say, hey, this is how much I'm worth to you. And I could save you time and money in the end, right? Because I'm doing this work already and you don't have to take the time to develop and create. Like, you might have that already in your little back pocket and ready to work, and just need that funding for it. So we're going to do kind of like a little activity here, kind of a call to action. So I think we're going to try to do some breakout rooms if we are able to.
Yeah.
So we want to identify, kind of right now, think about for yourself before we go into those breakout rooms, and identifying maybe a gap within your own county. Where is something that needs support, right? What's not being done yet? You know, maybe come up with PEI, so prevention, early intervention. Thinking about like how we did with our suicide prevention task force, how we framed that and talked about it. Or maybe it's an innovation project, something new that you can do that has not been done in your county. And then, you know, thinking about how you can advocate for that through MHSA, the OAC, and why your project would be important and why it would be maybe innovative as well. So we'll try to do some breakout rooms so you can kind of strategize together and talk about maybe what's going on in each of your counties and the ways that you can support each other in kind of brainstorming this. So you can kind of think about like having a budget of about $25,000 to pitch, right? And maybe you're pitching it to suicide prevention and to their task force and saying, hey, like we have this innovation or we have some PEI stuff that we'd like to work with. And we want to, you know, spend about $25,000 to do so. So we'll kind of break you into groups and see if there's some maybe new ideas, and we can come back and share those with one another so that we can support each other in finding that funding within your county so that we're not the only county getting some money too.
And I want to check in with folks from the staff about time. So we're at 1:52. Is it possible to do breakout rooms for us?
I was about to say, I don't think, I'm not sure if we can do breakout rooms.
Let's do Q&A. We can do question and answer. The reason why we put $25,000 is that seemed to be the magic number for our multiple counties for us to get contracts that did not need approval by the Board of Supervisors. So it happened in Tulare County, Kings County, Fresno County. As long as the budget we presented them or the contract was under 25,000, they were able to sort of find the money or move the money. So if you're developing a project and it's your first one, that would be our suggestion is keeping it under $25,000 because it seems to get through the gates somehow. There is a question here under number 3, suicide prevention looks like a link. It's not. I think it's there for, is it a link?
I don't remember. I think it is. Oh, it was like a practice budget if we were going to do the breakout rooms.
Oh, we had a practice budget for breakout rooms. So, so we're not doing breakout rooms. We want to open up for Q&A. So
I do see a hand raised.
Okay.
From Avalon.
Yeah, hi everybody. Thanks so much for this presentation. I think I'm coming from a slightly different background than other folks. I'm coming to this from a point of transitional housing work in org working in Riverside County, and we don't currently offer any specialized LGBTQ services. And I'm wondering if this is housing, which is our focus, is too far outside of the scope of mental health programming. Obviously, housing is a mental health issue. It's a public health issue, especially for transitional housing for folks leaving prisons and jails. And as we know, trans and queer folks are disproportionately impacted by the criminal justice system. And so I guess I'm always looking for ways for us to get more funding. And this is a project I personally care a lot about, is us starting to get funding to look into how we can best house queer and trans folks. And I guess I'm just wondering if you think that falls under this MHSA funding, or if that would just not meet their requirements.
Oh, that's a tricky question. I don't think if you're providing direct services, like things to people like housing, that is outside of prevention and early intervention funding. It might qualify for an innovation, but that would be a partnership with you and the county. My suggestion would be thinking outside of the box and providing not thinking about housing specifically, but maybe the wraparound services or the mental health supports that aren't in place for folks led by community members who've experienced homelessness. That to me sounds like something that would definitely fit for PEI and also might fit with intervention, like innovation projects. So I would be thinking less direct services and more support. Does that help you?
Yes, super helpful. Thank you.
Okay.
Yeah, because that's what I was thinking. I'm like, maybe it isn't those direct services, but it's like, what are the things like we think about like social emotional wellness, like people who have experienced homelessness, right? There are things that maybe they didn't get taught how to do or how to support themselves, or different things that are impacting them because of mental health concerns and needs. And maybe framing it around that, because that will show that need that once again, we need to not just provide them somewhere to live, but we need to provide them with other services and things to support them so that they can be self-sufficient, and then hopefully stay out of being homeless as well.
Yeah, and I know in our county, I mean, we're in a very conservative place, but like you can't even find a shelter that will allow you to take medication. So if you do have a mental health diagnosis in our county, it's very unlikely that you will find a shelter that will allow you to bring your meds. So you just remain on the streets. So there's just that example. I don't know what that looks like in your county, but that could also be a gap or a bridge to funding for you, is like that solution, like that, providing housing where you can have your medication or, something like that.
Thank you so much.
Yeah, you're welcome. So we have a question of what kinds of projects are you involved with in your county's LGBTQ task force?
So it's our task force.
So the LGBTQ task force that we have is our task force. So that is our Out for Mental Health task force, which actually began with, obviously with this project. And we started with a large majority of those a part of our task force were either trans or non-binary identified, because those were the folks that really wanted to do the work. But then we tried to do some relationship building with some of our county providers and other organizations, and we've been bringing them into our task force, and trying to identify that policy of what we want to implement into our county. The other things that we attend right now are just more in the background. They're not LGBTQ specific. But like I said, that doesn't mean that maybe one day in those meetings, they might come up as a topic, because we all know LGBTQ issues are a hot topic right now and kind of the buzz around things. And so just being a part of, even if it's just a general task force in your county, you could be that vital voice in that room, so that it's not someone who's not a part of the county or a part of the community speaking up for us. So we want to make sure we're kind of being that checks and balances within those task force if it's not LGBTQ specific as well.
Are there any other questions? Does anyone else have a hand up? And the Out for Mental Health task force that we're involved with is a 5-year project. It's also MHSA funded. There were 3 cohorts. We're cohort 2, so our work is taking place in year 2 and 3. And we had a convening that had 100 people at it. It was LGBT led and run. All of the breakout groups were LGBT led and run, all centered around health and wellness and mental health. And so that was exciting. It helped identify our policy priority for that would be sort of figuring out a way to create a policy that requires MHSA or our county mental health providers to have a yearly, at least one yearly training on LGBT stuff provided by LGBT people, right? So it's not a 90-minute training that sits on Relias and you go in and you listen to like some folks talk. It would be sort of comprehensive, and that's just that's the idea that we're going with, is that they do them now sort of voluntarily, but what happens when the people that really like us and like doing those trainings leave, right? If it's not mandated, if it's not required, we're afraid that if, say our ally Michelle or Yesenia leaves the county, that for some reason people will just forget that they didn't have a training for 5 years, and so we want to make sure that it's somewhere in the policy that it's required. And then that leaves the door open for other folks who do LGBT work to come in later and, and do the trainings.
Awesome. Is there any other questions anyone has for us?
All right. Well, if you think about anything or you want that sample budget that we talked about, you can email us. You can email Spencer@thesourcelgbt.org, and I'll put it in the chat. And we'd be happy to share anything or talk you through anything you want answers to.
Let me raise my hand.
Thank you so much.
Can I make a comment?
Yeah.
So I'm sorry, I was a little late, so I picked up at the end. So when you were talking about MHSA money and, getting somebody out there, as a chair to a mental health board in our county, that 3 minutes of having somebody, because our boards, Cal BHBCs are all advisory boards.
Mhm.
We advise the director, and board of supervisors on services that we want provided within our counties. And so those 3 minutes to come in and say, hey, this is what we're missing, this is what we need to look at, is so important. And the more people you get in there, the more they really have to listen. And those listening sessions on MHSA, I had another appointment I had to go to. You might have already covered this, but I just want to say, hey, get those 3 minutes, advocate in those 3 minutes, and let that board hear you so they can make recommendations.
Yeah, no, absolutely. That is definitely a big one. Those public comment moments, it sometimes is crickets. No one has anything to say, but that is the time where you're allowed to speak up and say whatever needs to be said. And it's that squeaky wheel gets the oil. So if you keep bringing it up, keeps, putting it in their ear, giving them that buzz of, oh yeah, hey, they keep bringing that up. When are we going to do something about it? That public comment is the time to do so for sure. Thank you for adding that.
Thanks, Pat.
Here, I will stop share. There we go.
All right. Are we at time?
It's 2:03.
You have until 2:20.
Oh my gosh.
Yeah.
Well, and we can't do breakout rooms, right?
Well, we can't. So I found a button. Hopefully it works. It might not. We can test it out and try it.
I mean, if you can do 2 rooms for like 10 minutes so that people can kind of talk about maybe, does anyone in the room have a PEI project right now that they want to talk about? No. Prevention, early intervention. Is anyone else funded through their county right now? Okay. So our breakout room was going to be folks going into it and coming up with an idea that would solve an issue for the county, right? So we can, instead of doing a breakout room, we can just pitch ideas here. Is there something that way we all hear what everybody has to say? I know that there are people at like NorCal, sorry to put you on the spot, but you have ideas, but you also have a very like interesting situation in terms of government and HHSA. Do you mind sharing a little bit about that and how that might complicate you being in some of the rooms that we mentioned, or is that too much?
No, that's fine. So yeah, we live in a very conservative area. We also have a very large religious institution, I'll say. Other people might call them a cult, who practice conversion therapy and are definitely not allies. This work for us is just kind of like being persistent, like you say, showing up to those meetings and voicing your concerns and constantly, being a voice for the community and showing up, so that they know that we're not going away. We're going to keep coming whether you say no or not. So that can be tough. And the other thing that I was wondering was, I know at our MHSA meetings, they don't really talk about funding other than innovation. And it's kind of like what you were talking about, with there's certain organizations in town that get all the money. That's what happens up here too. So we have been struggling to find a way to get funded by the county for the work that we're already doing and work that we could be doing. But that's sort of a steep hill to climb sometimes, because you don't really get the support. And the people who we did have as allies at MHSA as well as the county have either been fired, resigned, or on the way out the door. So I guess, I'm trying to figure out still, how do we approach them to get PEI funding or some of these other types of funding that wouldn't necessarily have to go to the staple organizations that all the big money goes to in this area.
Sure. So, I mean, suicide prevention, that's been the key sort of buzz phrase for us. Everything that we do, whether it's social emotional wellness prevention, it has been framed in a way that it's suicide prevention. So our trainings, our pop-ups, our education, our groups, even peer support groups. So that seems to be kind of an umbrella that they're comfortable funding. And so that would be my suggestion, is framing it under suicide prevention. You've got tons of data to talk about, that you can pull around suicidality for LGBT youth as well as adults. That has been helpful. And that has been sort of it was work for 3 counties. So, and all of them are very conservative. And that seems to be the way that they maybe sneak us in, because, they're saying it's a suicide prevention program, and it's focusing on the most at risk, and there's an easy case to make there for that. So that would be my suggestion.
Use the data, use the statistics. I mean, I think there's power in numbers that are, for some people, they can't really fight against that research at times, and showing that there is progress in supporting our folks and giving them that space, right? If you give them those hard-hitting numbers, they can't fight and just say, oh, it's just, we need help, right? It's, hey, here's these hard evidence. Here's the hard evidence for you to show you that by providing these things, we are gonna, work against suicide and be able to support these clients so that it isn't their last resort and things like that. We're trying to intervene with them before those matters and give them those tools and coping skills so that they can live those happy, healthy lives. And that's really just showing them that. And sometimes it is through the numbers.
And there seems to be a competition between the counties that are close. So if one, it seemed like once Tulare did something, Kings wanted to do it because they didn't want to be left behind. There seemed to be a very competitive aspect. I think it's because they share staff. So when someone leaves from our county, they go to Kings County, or when someone leaves from Kings County, they're running a program in Fresno County. So there's examples that you can use for your county where it's rural, conservative, religious, of counties that partner with LGBT orgs that have had. So you can say, hey, they're doing this in Tulare County, they're doing this in Kings, they're doing this in Fresno, because they are, you know the people who are doing it. So you can use those examples as well, they're doing it these other places. You don't want to be the last one on board. Some of them don't care.
As I was saying, in Shasta County, they wear that as a badge of pride.
I'm sure. But it has worked for the counties that we are sort of neighboring and sort of similar to. So that would be another tactic.
And just one quick question on the data that you use. I know in our area, it's really hard to get any kind of data on our community. So we end up using other national and state research, that is similar to our makeup, our county makeup of rural, conservative, religious, all those things. Is that what you do as well, or do you have better data than we do?
We don't have better data. No. Which was part of our innovation project. So we collected data during that project, but the sample size was small, it was less than 100 people. So we have some data, and it proved our point, right? But it wasn't research that could be duplicated. We use all the national statistics as well. We do some fancy extrapolating, we use a lot of storytelling, and most of us are consumers or have been consumers. So we can say firsthand, hey, this is what happened. This is who I came to. These are the services I got. This is what it felt like. And so those stories are really helpful. That's why the task force is really helpful. Everyone on the task force is a consumer as well. So they have, there's data, and then there's qualitative data and quantitative data. And more and more, I think the storytelling is powerful. But again, if you're talking to people who don't want to listen to your stories and don't empathize, it could be hard. But yeah, unfortunately, I don't know of any data. That's the problem, is that they're not collecting SOGI data, right? So we have an innovation project that's 5 years long. We're in our 4th year working with the county. One of the deliverables is collecting SOGI data, and they can't figure it out. So this is a fully funded project over a 5-year period, where one of the easiest deliverables is collect SOGI data in your electronic records, and for 3 years, they can't figure out how to do it. So we're trying, but it's like whenever you're working with the county, it's like it's these just incremental changes, because there's so much that we don't understand because we're not within the system. So, we have a foot in, but we're not completely in. So in order to change anything, it takes everybody to be on board, and it costs money, and that's where the conversation ends. Usually it's too expensive. Any other questions? There's some comments in the chat. Ty says, I'm a big fan of public comment. Thank you for that, Pat. Here in Amador County, we had great experiences using public comment at our local city, county, and school board meetings recently. We were really just introducing ourselves, but it was a great learning experience for everyone who was available to participate. We haven't attended MHSA or behavioral health meetings yet. And then Pat replies, MHSA has to have multiple meetings during the year due to their 3-year plan. Find out who is your MHSA liaison through your behavioral health board. Also visit calbhp/c website, and your county board of supervisors needs to be held responsible for services. Do you want to read the?
Yeah, and it looks like Luna asked a question, is providing services to a specific underserved population, such as non-binary folks, considered innovative?
If it's never been done in your county. So
Probably.
Yeah. If it's never been done in your county before, never been funded by an innovation project, it is. That was our argument. And Mandy argued it as well. It might not be innovative in Sacramento, or it might not be innovative in Los Angeles, but it was certainly innovative in Tulare County. Pat?
So there's a new program coming out, the EHR, and it's a pilot program. There's only so many counties that'll be involved in it for now, because it can be turning over your whole system into the system. It's going to be costly, but that should add to your SOGIs, because a lot of those will be asked and checked, you know, and it'll be in the system, and that way they can, you know, select and print, right? So that's a good thing. And if you don't know if your county is into the EHR, I hate acronyms. I have OCD, so you know that, make sure it's in the right direction. Find out if your county has it, if it's getting it. That's something to look forward to, and then encourage your county if it doesn't have it, so when the next second round comes around, you get involved in it.
Thanks, Pat. Is that the electronic health record?
Yes.
Okay. And that our county is actually, that's been their excuse, is they want to wait till the state provides them the electronic health record, which is great. I mean, then it would be standardized, right? They wouldn't have to create something out of nothing. So yeah, we hope our county will be one of those counties, because it would really help. And then we can hold the state accountable, because, you know, if they want us to collect the data at the state, they should give us the means to collect the data at the counties, is my sense, because the counties are asking for it. They're asking for guidance. They're asking for, how do we do this, you know? And so, you know, maybe there's an opportunity as community organizers to legislate for, you know, either accountability. I know that we've talked a lot about it, holding counties accountable to the laws, but also if you're going to mandate collection, then provide the tool, you know, at the state level. So
I think the other thing we have to look at is that so much money was allocated to it, and that everybody again is feared that if you overload a system too much, it's going to crash. And so implementing a little bit at a time and getting that one adjusted and ironed out, so that way when the other ones come in, it runs a little more smoother, and then the numbers kind of like, you know, smooth into that. They transition into it smoothly, and then your numbers will look bigger and better. But yeah, you know, you can't depend on technology all the way. You got to be kind to it.
yeah. Okay, we've got 2 more minutes. Any last questions? Okay.
Well, thank you, everybody. We really appreciate you taking the time to listen to us and share our story. Hopefully for you all, you may have learned something new or take away an idea that you can implement in your county, and just really getting that support that you need in the work that you all are already doing, and also getting funded for the work that you're doing as well.
And if you want to reach out to us, just visit the sourcelgbt.org. And all of our pictures and emails and all that stuff, all our contact information is on there. Thank you so much.